Hello, hello, hello. So my last shift, which was over a week ago, I I had a crazy shift. One of those shifts where everything is just so complicated. We had a few cases that have been referred from other practices, typical Saturday midday, Friday night. We can't deal with this. Here you go, take care of it for the weekend. That's what we're there for. But I had, for example, a pug that was really struggling to breathe that already had BOA surgery and it was just not coping. And I decided to emergency refer it because there's no way I was going to do a tracheotomy on a dog that already had surgery and it had failed, right? So we were doing this and there was consults coming in and I was, knackered. And then I think about midnight, I finally get around to the inpatients that didn't seem that critical. And there was a labrador that had been referred to us for abdominal pain, that they had scanned, they had looked, there was no obstruction. So they said, well, can you just give it pain relief fluids, monitor over the weekend and then re-image if necessary. So we thought, okay, let's check her over. She had been lying there looking really nice and stable. Let's check her over. Let's see if she needs any more pain relief, if there's anything going on. Maybe she could take her out for a pee. And as she gets up, her front legs are just completely rigid and she just face plants out of the kennel. And I'm like, oh shit, what the heck? And I did a full neuro exam on her. And this patient who was abdominal pain, fairly straightforward, now turned into a neuro patient that may or may not evolve rapidly into something there was no coming back from. So I examined her and it looked like she had some upper spinal issues. So I phone the owner, phone the referral. Does she need an emergency referral? To and from, to and from. And in the end, I managed to get a referral for next morning, and the owners were like checking the insurance and everything was fine. Whew, thank God, right? And then I handed her next morning, I explained what happened, and the vet who had admitted her the day before was like, "What? What do you mean it's a neuro patient now?" And I was explaining what happened, and then I went to bed. Anyway, at night, I come down to my shift again, and it turns out the dog, when they took her out in the morning, when the owners came to collect to refer her to the neurologist, the dog was so much better. She was running around, no neuroscience. They were going to go anyway because, what if it's like a coming and going thing, and she was a bit up in her years, no? And the other vet and I were discussing this, like that is so it's strange. No, but it's nice. Obviously, she was better, but like he pointed out, it's annoying when these things happen. You think this is what's going on, and I make a plan, and then the patient doesn't kind of adhere to the plan, right? It deviates, and now maybe I was wrong. Maybe it was not neurological. Maybe it was something else. No, and it made me really think about how we react when we are wrong about something. So in our work, obviously, when you are wrong about something acute, you have to make a decision here and now. Like, does it need these fluids and these fluids? Can I sedate or can I not sedate? And it's like life and death. There are a few occasions in our profession where being wrong can be very detrimental, right? But often it's more about being wrong kind of long term, right? So for example, uh, when I studied, it was all about when you have a stomach torsion, you have to operate yes or yes. There's just no way around it. Well, in the recent Congress I was to, we learned that actually you can deflate and you can play a stomach tube to alleviate the gas and kind of like stabilize the patient until the owners maybe get a head around what they want to do. And that was a new thing for me. And I thought, oh my God, I've put to sleep dogs in the past, not knowing that this was an option. I thought you just had to go in and operate. I was wrong. Now I have learned that, right? With cats, for example, obstructive urinary tract, there's always, when I studied, it was like we always gave antibiotics. Then I was told after giving antibiotics, and then we were giving muscle relaxants, and now we should not give them. There's always these, it can be a bit frustrating because we feel we're wrong all the time and we can't get it right. Just like with antibiotic use, right? We're used to giving something and now you can't give it, or suddenly it's like contraindicated. I am having so many discussions on social media about the use of metronidazole in diarrhea, and there seem to be like two camps of vets, like give it and then the diarrhea will solve if it's a bloody diarrhea, or don't give it under any circumstances, right? And one day one of us will be proven wrong, I'm sure. But it goes to show like how much we make it mean about ourselves when we are wrong, because it makes us feel really bad sometimes, right? Like I was wrong, and we just make it mean that I am wrong as a person. So I happen to be reading this book now called Think Again by Adam Grant. Because I personally have had to rethink a lot of my beliefs and opinions. I became vegan about 5 years ago, which has made me, it's kind of forced me to rethink and reevaluate a lot of my opinions and beliefs. For example, I used to, and now a lot of you are going to like throw the AirPods away and not want to listen to me anymore, but I used to promote raw food. I worked for that for a long time with my own clinic. I personally didn't have an issue. But obviously when I became vegan, then it seemed wrong to feed like raw chicken to my dogs and cats when I was not eating it. And it made me like rethink the whole how we treat animals, like how we treat pets versus farm animals, and so on and so on. And now I am supporting vegan diets or lab cultivated meat for pets because that's just something I approve of right now. That's what I think. And I feel like before I was wrong in promoting the raw diet, and I guess I was wrong in not being vegan or whatever you want to call it, but it's made me rethink a lot of things, and also how easy it is for us to get stuck in one belief or one opinion. Now I think like this, and obviously the algorithm on the social media are what are something that supports this so much, right? It's like the confirmation bias or desirability bias. For example, I'm not a Trump supporter. I can imagine many of my listeners won't be, but I really try to to not only look at the accounts that are making jokes about him being a mix between a horse's asshole and a bag of Cheetos, that which are really funny, but it just kind of like makes me consolidate that belief and that opinion I have about him. I'm trying to see it from the other people's point of view, so not get so stuck in this identity of an anti Trump supporter, no? Because in this profession, especially, we are working with science, which means that at some point we're always going to be wrong because science is always evolving. So what we thought was right yesterday, it's going to be wrong tomorrow. And I'm sure like there's a lot of stuff we're doing now every day that is going to go down in history as like, oh my God, what were they doing back then? My school children are going to sit there and shake their heads over us. And in science, especially, we really need to be okay with, okay, I thought you should always use metronidazole in hemorrhagic diarrhea. Now the case is contrary. Or I really thought that I should always give this specific muscle relaxant in cats that have obstructive urinary tract. Now it's actually contraindicated. Okay, can I change my mind? Or with a stomach torsion, can I change my mind about that as well? Because when we're really stuck in an identity, this is how I learned and this is how it is, you're going to suffer a lot. You're not going to be able to evolve with the profession where things are changing all the time. You are going to have heated arguments with younger vets coming in and having another opinion and other learnings. And also, it's detrimental to your patients because if you're not updating yourself and not learning, then they're not going to get the best treatment. And it could be that what you then learn new today could then again be proven wrong the day after tomorrow. But you kind of have to go with that, right? You have to go with what is the newest science and what do I want to apply to my clinical work that is proven. It's not just like urban legend or whatever we're going by, right? And here's also where the imposter syndrome comes in. If you make it mean, so if I, for example, think about the stomach torsion thing, if I make that mean about me, that I was wrong, that animals died because of me, which they probably did, that means that I am wrong and I'm a bad vet, then I just can't keep working. I can't keep thinking and judging myself for doing the wrong thing, quote unquote, back years ago, when now there's change and now there's updated information. And it's the same with a case that maybe is evolving, right? If you thought, for example, that the skin case you were treating, you were like absolutely convinced it was a fungus, for example, and you take your samples, but you start treating it for it, it doesn't get better, and then you finally reach the diagnosis, no, it was like some complicated pyoderma or allergy or something you couldn't see coming. If you make yourself wrong for having made that initial diagnosis and treating that, and you take it on upon you, and you think that then you're a bad vet and you shouldn't have done that, and why didn't you get it right the first time, and this and the other, you are making a lot of what you do day to day mean that you are wrong as a person and as a vet, which is not true, because actually discovering that you're wrong is great, because now you're less wrong than before. And often I will turn it around. For example, when I'm in the emergency room and I say to someone, right, I think it could be an obstruction, so let's do x-rays, let's do an epoch, let's see what comes up. And then I do all that and there's like nothing, nada, no clue. I can then say to them, really good news. it actually wasn't an obstruction. It must be something else. So now we need to keep investigating. But I'm so glad we ruled that out. And I do that with X-laps as well. If I go in and do an X-lap, absolutely convinced it's an obstruction, and then it isn't, I will call the owners and I will say, I am so glad I was wrong. Because if you had, like, if I'd had to go in and do an enterostomy, that is dangerous for the animal, and you can end up with a septic abdomen, right? So being wrong can be really, really good in these cases. Or with the dog that seemed to be a neurological patient that went from abdominal pain to neurological to actually being absolutely okay. Me being wrong about it being some complicated upper spinal disease is a good thing for the dog and a good thing for the owners and their finances, right? I can't then criticize myself and sit there and beat myself up. And why did I think that? Why did I do that? What didn't I see? What should I have seen different? Why didn't I, whatever? No? It's just going to be detrimental to me. And I need to, especially in out of hours, you have to be able to make quick decisions, and you can't sit and waste time beating yourself up when you make the wrong decision. Saying that, I'm not saying we shouldn't learn from it, but that's why I think I mentioned in our earlier podcast that you should always evaluate what you've done and your actions and your diagnosis. If something is churning in your head and you're beating yourself up, like evaluate it following the 3-step evaluation process, which is what went right. So, okay, so let's take this case. What went right? But well, I saw that there was something wrong with the dog. I took an action really quickly because if it needed referral to neuro, then we needed to get her in quickly. And I also really quickly updated the owners. And I also made sure that the dog got some stronger pain relief because I thought spinal pain can be really bad, right? So those were the things that went really well. What didn't go so well? Well, I kind of wish that I had gotten to her before. I prioritized other patients over her because I thought she was an abdominal pain just chilling. Um, I maybe rushed my neurodiagnosis, but I don't really know what I would have done different. And then what would I have done differently? What would I have done differently? I will try and um be more, I guess, aware of inpatient signs, like maybe get my nurse if I'm busy with someone or something else, at least to get them to stand up so we can see if there's been any change in them. I might, instead of rushing into a neuro referral, I might say, okay, let's wait and see how it is tomorrow. But again, if I'd done that, she could have deteriorated and it could have been too late, right? So me thinking I was really wrong, I shouldn't have done that, then when I take it and evaluate it, I was like, well, I wouldn't really have done anything different because it could have been detrimental to the patient. So that's something I really want you to do. If you have a case or something you have done in the past and now you're like ruminating over it, then actually evaluate it properly, put the facts down on paper. So it's not just like, oh, I shouldn't have done that, or why did I do that? And another thing as well about being wrong in vet med is that you have to be really, really willing to be open and to change your belief. Because I do sometimes come across more experienced vets that can occasionally be very stuck in, well, this is how we've always done it. And also sometimes it's younger vets, no? Like, but this is how I was taught in uni. And I'm like, well, this is real life. So maybe you want to be doing it slightly different. Um, and if you're like really stuck with your belief and you're really stuck with your opinion and you attach your identity a lot to that and you're not willing to change, then that is gonna lead you to complaints. It's gonna lead you to big failures as well. It's gonna lead you to your colleagues calling you out. And then you beating yourself up further in the future because you were not willing to change in the past and now you realize how long you've been wrong. Um, so summa summarum, what I want to say is, what I want you to take away from this episode is, first of all, in our profession, we're going to be wrong all the time because, first of all, science is forever evolving. So what was right yesterday is not going to be right tomorrow. Your clients are not going to adhere to whatever you think is wrong with them. They will often not follow your plan and they will often prove you wrong. And that is great because once you find out you're wrong, now you're less wrong than you were before, which is amazing. That's actually something he says in this book, Think Again by Adam Grant. I'll put it in the snow notes. And also be willing to explore how can you be wrong here? You know, like just like any scientific method is, I think XYZ, now let's go and disapprove it. And if we can't disapprove it, then it's true. So if you have a diagnosis, I think it's this, but let's prove me wrong. And then you do prove yourself wrong, and the diagnosis was not, for example, a fungal infection, it was an allergy. Okay, great. You proved yourself wrong. Your experiment has concluded, and now you have a new thing that you can analyze. And so be willing to be wrong. And also when you are wrong, even when it goes horribly wrong, don't attach that to you, to your identity, who you are, how good of it you are, how personality wise you should have been more XYZ, and use the evaluation process that I've taught with what went well, what didn't go so well, and what would I do differently to analyze could you actually have done anything differently with the information you had at that point. That is very, very important. And that is how you overcome imposter syndrome as well. Because if you let your brain ruminate over all the things you've quote unquote thought wrong or done wrong in the past, then that past version of you is going to prove that you are horrible bit now. But whatever you knew back then or you did back then, you did with the information you had, right? And now the information changes. We are like, okay, so before we did this, now we do this. Or I don't really know if this information is truth. Well, let's investigate. Let's find out. Let's find the studies. Let's discuss with colleagues. What are you doing now? Are you still giving muscle relaxants to cats with urinary tract obstructions? Are you still operating straight away on stomach torsions, and so on and so on? I would love for you to reach out if you have any comments, if you have any cases where you have been really, really wrong, or maybe things in the past that you used to do. For example, my generation was like dexametasone for everything, and obviously I don't do that anymore. Is that something that you used to do that was really, that's gonna be really considered wrong now? And is there anything that maybe as a recent case where you were proven wrong and you're actually glad that you were wrong? Let me know, send me a message, or if you're on YouTube, post it in the comments, and let's see what we all are getting up to. Lovely to speak to you. Have a great rest of the week, and speak to you next week. Bye.